A doctor that is not healthy, you want him to be a magician, come and make sure your own person you are bringing is healthy. Do you ask yourself if you slept over the night? A doctor that gives 5,000 naira gift to somebody and is thinking throughout the night, how will I match up these 5,000 that I dash out from my salary? From my allowance, how will I balance? Okay, it's riding Okada. The one that has cars, the cars are rickety. The one whose cars are not rickety, they Okada, they even sustain injury as well. Otherwise, you even see them, they can be kidnapped because they are answering doctors. Who paid the ransom?
Healthcare delivery in Nigeria has experienced deterioration because of underinvestment by successful governments. This is a far cry from the 1970s to 1980s, when the country was a hope for medical services. A combine of the brain drain of medical professionals, poor infrastructure, low investment in medical research and development, remuneration issues that have led to preliminary industry actions by various medical professionals, leading to a crisis of confidence in the healthcare system. As of February 2018, the country was ranked 187 out of 191 countries in the world in assessing the level of compliance with universal health coverage, as a very little of the populace is health insured, whereas even the government budget for health services is insignificant. Out-of-pocket payment for healthcare cause households to incur huge expenditures. Now, let's look at the health budget allocation. Statistics shows that Nigeria's health budget has consistently fallen short of the 15% Abuja Declaration target. In recent years, the allocation has been around 5% of the total national budget, and a cumulative funding gap of approximately 13.39 trillion naira, and has been identified over the decade preceding 2025. For example, the 2025 budget proposed 2.38 trillion naira for health, which was approximately 5.18% of the total budget. The standard ratio for doctor to patient in a country is 1 to 600, but in Nigeria, it is 1 to 6,000. In the last 5 years, 6,000 medical doctors have immigrated to either the United States or United Kingdom. So what can be done to address the crisis of confidence in Nigeria's healthcare system? Hello everyone, welcome to WebTV Focus program. I am Gabriel Jude. Today we shall be discussing a critical issue which is addressing the crisis of confidence in Nigerian healthcare system. For they say health is wealth. And my guest for this edition is Dr. Jimmy Arigbabuwo. He is a specialist family physician and healthcare management consultant. You're welcome to the program, sir.
Thank you.
Right. So before we begin the conversation proper, let's have some reaction videos from the public and their perception on the healthcare services and delivery in the country. We'll be right back.
Let me just firstly commend the government. They are trying, they are putting in their best at least to have a best hand in the Nigerian hospitals, both in general hospital or primary health center. They are doing their best. But notwithstanding, I could remember a few years ago that there was a time that I got ill, that I have to use the primary health center. So, and I went there. So all the the treatment was free. I was even given the medicine, apart from the injection. But now that's not the same scenario. You have to pay everything. You have to pay everything before you can enjoy anything. And not only that, even most of our some and don't let me say the nurses now. No, some the practitioners, some of them, they believe that it is government work. So once you hear government work like this, so you're on your own. So it's not like when it is private settings that that you have to work hard. But when it comes to government settings, some people they believe that is a national cake. Let me come and eat my own cake.
I'm a little bit skeptical about the healthcare system in Nigeria. Let me say Lagos precisely because this is where I based. Because I'll use my dad as an example. When he was not feeling too fine, we rushed him to General Hospital in Ikorodu. The way they attended to us was not that good. Let me put it that way. So if I'm to rate it 1 to 10, I'll say at a 10, I'll say maybe 4/10 because they didn't attend to us well. So they were not professional, especially the nurses. There was delay in attending to emergency situations. But from what I've been hearing, so far so good. I think there's improvement. I hardly go to the hospital, but there's improvement because there's a friend of mine that visited the hospital recently in Bagada. The way they attended to her was very swift, unlike what I experienced previous years. So for me, I think for now, if I want to rate Lagos, I think Lagos State is doing well. To be honest, Lagos State is doing well health-wise. So if I still want to rate it 1 to 10, I think I'll give it a 7.
In healthcare system in Nigeria, as you can see, everybody is on his own. The government is not footing the bill of the health. Under normal circumstances, health is supposed to be free for everybody. But now, both young and old, you have to pay for health revenue. So it's supposed to be free, according to my own view.
So I had a bad experience with it because in this Ainke back here, I lost 2 people, a sister and a friend. Last year and 2 years ago. So not that we don't have a good people, but medical, let me say, equipment is not that enough. Sure, you understand? And I don't know who is in charge of it. Maybe it's people that don't want to bring it, or it's people, or they bring it and they use it in another places. I don't know. But in this Lagos State, most especially this last suit, no. And I was told it's 2. Government has its own, private has its own. In the same lawsuit. I don't know, I can't confirm, but the way I see it, what happened to my sister, I think it's private hospital that they took us to, not the general hospital. After the operation, they now told us they need blood, they need this, they need that. Before we knew it, 2 days, she gave up. And they asked us to pay almost ₦1 million before we can take her back. So I can't really say much about that. That is when I lost interest in this medical of a thing.
I'm from rural. In rural area, most of the villages, there's nothing like modern health facilities. Let me tell you the truth. We have, in the place I come from, we have about 20-something communities. There is one health center. That health center it has no pharmacy. You see, in a community that we have up to 5-6 different villages, there should be a medical center. If it is possible, from the general hospital, they should be sending at least 1 doctor, maybe once a week, to deal with these people. When people know that on Wednesday, doctor is coming from town, they will go to that medical center. Then the person will have to do the work for that day. So all of us will know that on certain day, medical doctor will come.
We're not supposed to be paying money in the same because we're paying taxes.
Another thing about is that is really affecting the health sectors is the finance aspect of it, and I think that's the most important thing, and that's why we have issues that people are not bringing in their best to practice. Because if you compare it to Nigeria and other countries in the whole world, you cannot compare what they are getting in returns. So one of these is affecting the health sector. So I believe if the government can do necessary things, especially about their finance, their salary.
Now that we are in era of technology, I think that's the best way to go, where you can easily access with your phone. You can book appointments, you can diagnose your sickness. You understand? At least before you get to the hospital, you've done some assessment. At least technology-wise, I think if we can use more of technology to diagnose sicknesses, to attend to patients, do you understand? I think it will help us. Then also in staff training, especially the front desk people. You know, before the doctor treats you, the way they attend to you also will even make your mind calm down. You know, when you get to the front desk, the way they neglect you, it's before you even see the doctor, you might have been halfway dead. So staff training in front desk, especially the nurses, keep periodic trainings. Do you understand? Then, like I said earlier, on technology.
Okay, from the video we just watched, so a lot of comments. Some talk about government footing the bill, service delivery, adequate facilities, and especially, I want us to really look at the rural communities, rural areas, so critical, because just rightly what you heard the man saying on the video, and also funding, but while reacting on the video, they say health is wealth. But the Nigerian case is the reverse. Maybe if I'm not right, you can correct me on that, but how did the country decline from leading in the 1970s to 1980s, and then now we are in 21st century, it cannot be global competitive?
Thank you very much. Yes, that the term health is wealth. It still holds. But when you say it's reversed, it's like we now say wealth is health. Well, it all depends on how we look at it. We should be able to define what we mean by wealth. And in any case, let's leave that so that we won't dwell too much on that. What is key is that going by the era you mentioned, for example, the 1970s, leading 1980s, where we're coming down. Yes, the system is dynamic. If you have a system on ground, it is supposed to be dynamic. Things move, things change. And Nigeria cannot be that isolated. We are part of the global market. The out-of-pocket payment had been the attitude. When you have out-of-pocket payment, somebody paying for health from pocket, to as much as 70% of total expenditure in health, people are paying from their pocket. Whereas we are targeting to say, bring the out-of-pocket payment down as low as 30%. It's not as if you can eradicate it completely, but let it be as low as 30%. However, the issue with public health is germane, is key, because health is supposed to be part of fundamental human rights. And that is why you still see the populace saying, are we supposed to pay? Is it not supposed to be free? Yes, they are tax-paying citizens. They will be saying that. They have the right to say it. Another area for us to look at critically is that what percentage of our people actually pay tax the way we are supposed to pay it. But people also justify it. They say, yes, it is not as if we are not willing to pay tax. What amenities are they putting on ground to justify what they are using our tax to do? We pay tax, yet no light, the roads are bad. So many things are on ground that they can complain about. We also look at the fact that, okay, the tax, the health vote, 5%, been roving truly between 3 and 5% for quite some years. But the absolute vote to health is not as important as the budget performance. After all, it will be an irony of fate or a surprise for you to hear that at times, maybe the Minister of Health, after some time before the end of the year, will still have to return some money back. Money that have been voted for health will still have to be returned back to the government purse. That this was not the amount that was not spent to, we are returning back. There was somebody now ask, they say something is not enough, you are still returning some money back. That has to do with what you call budget performance. However, some key areas we need to know. Health is not cheap anywhere in the world. And not just health. Quality health should be our watchword. We also have a system in Nigeria, in our health system. The trado medical people, they are embedded in the system. Who will advertise anything on the road? Number one, what's the level of literacy of our people for them to even be able to claim their right? People go on television, they go on radio, they go everywhere. Hey, this medicine will cure 1,000 diseases, will cure 100 diseases. There are times this information can be misleading. And before you know what is happening, the people's knowledge about their health status and healthcare seeking pattern is almost equated with their level of formal education. Having said this much, there is no how you can care for healthcare finance in this country without resorting to health insurance. And that is a system where the token you pay as either premium will contribute like a susu, you put in the common basket. It's only those that are sick who use part of that money. Everybody cannot fall sick at the same time. So that large pool in the basket will make healthcare delivery possible by tapping from that basket to provide. However, we must target the informal sector, which is the rural population. About 70% of the Nigerian population are based in the rural areas, for example. These are the people for which reason there is what we call basic healthcare provision fund. These things are for the vulnerable group. Okay, children under 5, pregnant people, indigent, unemployed, we have them all like that. These are the people that constitute major concern for us. And even in health insurance, we must do cross subsidization for them. We take from the rich to balance even for those who are not able to afford.
Issue of insurance, we'll discuss it later, but I want you to establish the fact that you mentioned something about dynamism. So, and Nigeria is in the global market. Are we supposed to be dynamic towards declining from where you've been doing well, you now decline? Are we supposed? I want you to clear that fact just in 1 minute, please.
Thank you. You watch carefully. The well of this world, you only draw from it what you have deposited in it. The type of system we have on ground deserves that leadership is key, and there must be the political will. When a leader is passionate about a particular area, like you say the health, or you say electricity, you say infrastructure, many things are on ground that are competing. Now, health is key, and you don't politicize it, because a healthy person is the only one that can be productive. So, whether you are declining or not, the question we are going to have on ground is this: what is our attitude to issue of accountability? How are people who have elected to lead us, how accountable are they? Are they giving us audit? Are we putting them to book if they are not doing well? Is it business as usual? The other time, because of Abuja resolution of 15% or whatever, what are we having today? And why is it like that? People who are put in custody of these resources, are we holding them accountable for what is put in their care? It is time we let ourselves know that it's not about beckoning at the vote we want that matters alone. What matters is accountability, responsibility, partnership, cooperation, collaboration. These are things we have been talking about, that when you do what you call public-private partnership, for example, you begin to balance up. You begin to be accountable. Not that people see this, oh, this is government institution, oh, this is government property. You do it as if government has no business in business.
Accountability, like you mentioned earlier, how can we militate against the service delivery in the health sector? Now, let me share with you the recent communique from the federal government talking about the red letter, which you are aware of. Part of the content says that 32.9 billion naira has been disbursed to across the country, to the health sector, primary health sectors. And then part of the communique stated that, which I want to cut it here, to say that your clinic money is your own. Now, it is your community chance. It is your country's, promise. How do we ensure that there is monetary effective yielding value?
Thank you. Our issue stems from local government level. Now that we are now even having local government autonomy to the state, then to the federal. We need to reassess our moral value to be able to do audit and accountability. For example, as an ordinary citizen who wants to complain, to have what you call community analysis, situation analysis, community mobilization, how effective is the people you put up or is the committee you put up they'll be able to have access to the local government chairman or to be able to access Mr. Governor, for example. What are the barriers you will face before being able to access those who are at the top echelon of responsibility? For example, when they block you, they block your committee. Is it people you phone that will not even pick your phone call, that are even your own councillor or your own local government chairman, not to talk of members of assembly, not to talk of National Assembly, when you don't have access to the people we say, go and meet, let them tell you how they have been spending your money. To me, it looks like we already know the barriers these people will have before assessing those people in authority. So there must be another way of making people to be accountable. And that is to say, okay, we have financial institutions, okay, EFCC, this and that. When there is collaboration to be insincere, and we have what you call ineffective audit system, how many persons have been brought to book, really, because of corruption? Are there not corrupt leaders who are moving right around now freely on the street, despite the fact that they are not accountable to what have been put in their care? The people we have in the villages, rural areas, they are getting more frustrated every day. It's a good language to say, hold your governor responsible, hold your local government people responsible. That is very good in the dictum of that language. But in pragmatic way, how can committee of poor citizens, committee of peasant farmers, committee of community users who even put their little own resources together to build the community, right from the CDA level to CDC, people use their own resources to build the community. I was a CDA leader before, for years. I was also the local government authority chairman, for example, of a local government. I knew the barriers we faced during the period. Is it that going to be easy for you to just walk up to your governor, come and tell us how you have spent our money? By what machinery? You want to go to state assembly? The members that are there too, are you not going to have barriers assessing them? So I think even our leader, our president for now in Nigeria, who is ready to perform, who is ready to deliver, should hold the people at the regional and subnational level responsible by telling them you will be brought to book if you are not doing the right thing.
So we have seen cases where people who have raised concern that the local government chairman are not even going to be after elections. So the issue is that how will these people hold who responsible? Where would they see them?
Thank you. The peasant people in the rural community, they are hungry. And when they are hungry, the peasant and small chips and crumbs you bring to their table make them not to live up to their social and moral value. And because of that, any little thing they give them, imagine somebody packaging rice for you, or packaging gari and kuli for you, and packaging things that will look to you as if you are compromising the future of your own generations of children that are upcoming. Irrespective of what bad things those people have done before, they come back to you again that they want your vote. And you begin to say, oh, my one, is our person, let the person do it. You begin to sing all over the place. A display of what I've always told people, you see, perennial poverty demonstration as is coming out of frustration. For example, how can you give me 10,000 naira to come and vote for you? And I take that money so that you see the leadership and the followership, they are now beginning to ride in the same boat. And you do not even think of the future of your children. Why are people traveling? All the children you see in the Mediterranean Bay, you see them in the Atlantic. Even those who go to Europe and America, the kind of language they use for them in some days there, they feel like deporting themselves on their own overnight. So go and fix your country. Go and fix your country. Is it a good language?
Don't you think that there is something wrong with this red letter?
The red letter, sir, can be implemented this way. Let me suggest a way it can be implemented. The society, the community must choose their own leaders who are courageous. Leaders to implement this here are not going to be politicians. They are going to be people who are passionate. They are going to be people who are community leaders and people who have passion for taking care of the less privileged. People who can be held accountable. That come, you don't do this in this time around. The next time you are coming out to ask for vote, we will beat you. We will humiliate you. We saw it in India happening. People hook the tie of their politicians and they gave them beautiful humiliation to say, look, you are coming to ask for vote again. For the 3-4 years you had gone, we didn't see you to perform here. What have people been doing with constituency allowance that they collected? What have they been doing? These are the issues. When you carry this banner from generation to generation, children to children, our children will think it's the norm. When they themselves are coming to be cancelled or anything, that is the kind of attitude they are bringing on board. We need to assess and reassess our moral value as citizens.
So let me take you through an issue raised just in the recent times about which I think is coming from the work ethics culture, sympathy, negligence, and more in the public health institutions. For example, a recent tweet on negligence in one of the tertiary health institutions generated several, reactions. So people talked about sharing their own views on what has their experience and what has happened to them. How can we address this systematically?
Thank you. I think actions and reactions are usually equal but opposite. For example, workers need motivation. You have to even understand the type of workers you have engaged. If they are not people that are bringing burdens from home, from their families to the office. It's not only in that sector. It's a thing that is pan or global. People are coming to duty. First of all, they resume late. When they are there, no smile on their faces. When the month ends, they are complaining bitterly. They are even threatening with industrial action and strikes. When they are not happy, those are the things you should be expecting. Some are overworked, overloaded with hours of duty, that they are weighed down. Some suddenly collapse and die while on duty. These are issues. So we need what you call the biopsychosocial aspect of medicine. You must, as you are diagnosing the patient, you must diagnose the healthcare giver. The person who wants to give the healthcare may also be suffering from some, let me call it depression, that is not able to be sung out, to say out, but it's written all over the face. And you will see it, a doctor is in the consulting room, is to load up 100 patients that are waiting to see him orally. The same person did night duty. He has resumed 8 a.m. the following morning. He's doing the duty overnight. If he does not even die there by collapse, by accident, by anything, he is not happy with what he's doing. And that's why we see some patients, they say, before I even come in to sit down, doctor has finished writing about my complaint when I've not even said anything. And he's already writing my prescription. He wants to clear 100 patients plus waiting out there for him. He has an option. If the patient does not die, he himself will die. If he doesn't die, the patient will die. These are the things we are failing to face. You have to structure the hours of work duty that will not have diminishing returns. It's not only in the health sector, it's everywhere. But it's worse in the health sector because every person will start reacting when the life is lost. Every person will start reacting when the sickness is on and it's not coming down. Is it the doctor's fault alone? Even the medicines he wants to use, is it the manufacturer? What about the pharmacovigilance, the quality of that medicine that is prescribed? Once the patient uses it and it's not working, he doesn't talk to the pharmacy, say that doctor doesn't know what. See what he gave me, it's not working. I'm not getting well. Bad Nigerian doctors. Nigerian doctors are not bad. They are front line in all the continents of the world. Go and see what is happening. So those who Japa syndrome, the countries they go to, they worship them. They worship them as frontline people. But you need tools to work. A farmer going to the farm without a machete, without a cutlass, you say it's not doing well. That's the situation in Nigeria, for example. When they get to where they are going, they tap and do everything. Mental arithmetic is what Nigerian doctors use. Slide rule that we're using those days. We don't use who knew about calculator. Our brain is what we use. But we are going there to go and compete with people who just use computer to fix everything for them.
So don't you think
the Nigerian healthcare givers, healthcare providers, they are smart and excellent and well-tutored people.
Don't you think that a doctor who is going through some kind of problem, maybe some issues that he couldn't, don't you think he should explain? I think we should take responsibility in this dealing with patients.
Yes, not only doctors. Pharmacists and nurses have been doing the same thing. It's not only explaining. How many times will we explain? When you keep on explaining, and people now start doing what you call political comparison. When the doctor and the nurses and pharmacists are complaining, they say, are there not people in Ministry of Works? Are there also not in environment? Are they not ministry? Are you not all civil servants? You compare apple with apple and you compare orange with orange. When you compare the wrong thing, let me tell you, the doctor is not a superman. For him to even be able to work well, he must also take care of his own health. A doctor that is not healthy, you want him to be a magician, come and make sure your own person you are bringing is healthy. Do you ask yourself if he slept over the night? A doctor that gives 5,000 naira gift to somebody and is thinking throughout the night, how will I match up these 5,000 that I dash out from my salary? For my allowance, how will I balance? Okay, riding Okada. The one that has cars, the cars are rickety. The one whose cars are not rickety, they ride Okada, they even sustain injury as well. Otherwise, you even see them, they can be kidnapped because they are answering doctors. Who paid the ransom? We have lost people like that. And this is what we are talking about. You have to find a way to do some level of internal mechanism rearrangement and organization, that the workers are motivated adequately. Don't wait for them to be threatening on strike, industrial action. When they go on strike, the private practitioners, you expect them to be the beneficiaries. It's not true. They still come here to throw stones on the louvers and the building. In fact, they beat doctors when they come around. Patient beats doctor. Maybe you don't know. They beat them because they are your friends up to the time you want to pass the bill to them to pay. When the bill is to be paid, you become an arch enemy. That who is free. At the end of the day, even those who are coming to steal in the night to do robbery, it's only your cousin and your nephew you are robbing at the end of the day. So we have genocide that is happening quietly. The system is setting us against one another.
So now let's talk about PPP, public-private partnership model to improve healthcare. There is a conversation going around having PPP. What's your submission?
Yes, the PPP issue can work well if it's well framed. The private person is set out to make profit from his own organization. So if you now have the hybrid, public-private, you use what you have to get what you don't have. A man who is versatile and good in business management is put on one side. You coming from the public, you put the infrastructure, put everything on ground. You tell the private man, come and manage it for me so that we are not going to run losses. That's how you're going to do it. But don't also forget, at the end of the day, the bulk of who will pick the bill also happens. 30% are the elites you want to talk about. 70% are rural. So you can also have your way to the airport. You want to go to Abuja. There must be that gateway, social gateway that will take you to the airport. When you get there, somebody can upgrade to first class or business class. Majority will be in the economy. So you have to now balance it. Take from those who have, balance with those who don't have, and have what you call mutual health insurance system. Okay, so and that's what I told you about health insurance. So
what is the roadmap for a healthcare system in terms of budgeting and financing?
Thank you. If we like today, let's put the budget to health to be 25%. The question is, what will be the budget performance? It's not the absolute amount you allocate that matters. The performance is what matters. So whether you have 10%, 15%, 25%, ask yourself, what's the performance? And that must come from vision and mission. You must be visionary. You must know what you are looking for. Let us make sure our primary health centers, let's fortify them to the level that at least let's be working to encourage doctors to be able to work there. Even if it's not all the days of the week, some days of the week we do. It will increase people's confidence. Let us, all our general hospitals, let's upgrade them. Lagos State is doing that right now as I'm talking with you. They're upgrading, they are doing a lot to make sure the public healthcare facilities gain the confidence of the people. You now do training, workshop and capacity building to increase the awareness and motivate our healthcare workers to be welcoming and embracing when the patients come in. Not when you give them money that when they convert the dollar and naira together, they say that they are taking peanuts. It is the peanut that makes it to look today that every family in Nigeria now has somebody in the diaspora, at least one person. You won't know this until when there is crisis. Somebody will come up from there, phoning you from Italy, other can phone you from Europe or America. How is it my mother you treated like that? I'm going to litigate you. You are fighting on a system that's not even on ground. There is a difference between system being on ground and you say, oh, this is a faulty system. System is collapsing. We are talking of system not even being on ground. So we must put structures on ground. Those who are going to do it, whether they have gone to Glasgow, they have swayed to Saudi Arabia, Canada, everything, encourage them. Do what the Asian people did one time. And make land available, make everything available. Give them loan, give them capacity that will make them to come down from the diaspora, to come and practice and survey this country. Those of us that are here, you look at my age. If you don't know I'm close to 70, I may look so small like a young boy. Wow. If it was still possible for me to do Japa, I will even leave my private practice and cross the border. But let our children be doing that now while we are still here.
We need people like you here.
No, in fact, even if you give me the money now, what do you want to use to do? I want to buy money.
Your experience matters.
I want to buy money. I want to sleep. No, I say give me money now. If you give me 1 billion, what do I want to use it to do? I don't even have an idea in my brain again what I want to do private money to do, except I will mentor people, help them, because I'm floating what you call foundation and other things now, and encouraging the younger colleagues who are coming from our back. And I'm a private sector practitioner. Facilities that I have opened, I encourage them. Young doctors, young nurses, I do things to make sure this country is worth us salvaging it. All of us cannot run away. So, doctor, in 2-sentence paragraph, what is your word for the government, doctors, individuals? The government, my advice to the government is this. Every leader we have in government today should go and renew their relationship with God. Because if they cannot hold their people they appointed accountable, God will hold them accountable. Say you are looking at me today now. If I die only once, I will go. And the word remain for me is maybe resurrection. So who will I be afraid of again? I am not going to start stealing and using Bible to take money. So if you want to count an offense against me now, you are offending God because I'm not ready to do deal or business. So let those who are our leaders remember and ask themselves, if I leave this stage today, what legacies am I giving behind? And if the angels are possible that they are bringing their trumpet today, where will I be? That is my take for them. If you like, build 100 houses on the bridge, on the ocean, in the air, you cannot finish using one bed all alone. The things you leave behind, even your generation cannot maintain the building. 10 years after your death, it's not a forest. So we should tell ourselves the truth. With the money we are earning to get, what is it for? The looting we are doing, what is it for? God will hold everybody accountable. I'm not here to sermonize. I'm only letting us know the end of our journey. And that's the truth. That's my word for them.
Wow, I think I'm full. Thank you so much, Doctor, for
God bless you.
coming on this.
I remain Dr. Jimmy Arigbabuwo, a private sector man ready for PPP, ready to be used at any time to increase capacity, to mentor people, to talk to conscience, so that I can move the nation forward. And tell those in diaspora, our children, come back home, come and fix it for us. At old age, do you think I want my children to desert me? They have been praying in Nigeria, God give me picking. Okay, after giving me children, do I pray they should leave me to suffer in Nigeria at old age? Whether they send money to me, it does not matter. A time will come, I want to urinate. I need somebody to assist me. My brother, I'm only being lousy with this language. It's the truth. Stop pretending. You stay there. You're hiring a housekeeper and a caregiver for me. If I hold you, I hold your touch, my blood pressure will come down. And I need my children around me. Just like people need their children around them. We must be talking globally. We must be talking like Nigerians, talking like children of God. And knowing that one day we will go and give an account to our Creator. Thank you.
Doctor, this was really fire. This was really valuable. I thank you so much for this valuable
my brother. My
conversation.
pleasure.
Yes,
God bless you.
Thank you, sir.
Thank you.
Thank you. Before I conclude, here is my closing thought. For Nigeria to improve the healthcare system, there is an urgent need to increasing government and private investment in healthcare, strengthening primary healthcare system, expanding health insurance coverage, addressing brain drain and medical personnel shortages, and leveraging technology and telemedicine. That will be all for this edition of WebTV Focus program. For more information and knowledge on finance, the market, banking, the economy, and investing, please visit the ProShare website, WebTV YouTube, and follow our social media platform displayed on the screen. More so, if you have any concerns you want us to look at in our program, do well to put them in the comment section, and that will be appreciated. Thank you everyone for watching. I am Gabriel Jude, and have a great day.